Welcome everybody. Today I'm going to talk about native Australian flora used in bush medicine. My name's Serina Biddle. A little about me. I'm a registered beekeeper, currently doing Certificate 3 in beekeeping with trap and store pollen as an elective. My sons and I have been working with bees since about 2017. I had a 22mm Chiari malformation with my first surgery in 2012 called a Chiari decompression, in which they removed part of my skull, put in a dura patch, and did a spinal laminectomy of C1 and C2, and I also had a titanium Chiari plate added in 2015. I'm currently studying the Apitherapy online course with Dr. Stefan Stangishu and at apitherapy.com, and I'm also a current member of the Australian Apitherapy Association. This is my first talk, so I'm a little nervous. If I fumble my words, I'm sorry. So here we go. And this is me with my bees and my two sons, Cody and Zach. I live in Clearview, South Australia. There's my contact details. As I said, I live in Clearview in Australia, in South Australia. So this is South Australia down here, and we've got Adelaide right down here. So this is Adelaide, and I'm up in here in Clearview, which is about 10 minutes from Adelaide. We also have beehives all over the suburbs of South Australia. And today I begin acknowledging the Kaurna people, the traditional custodians of the land from which my presentation is being given, and I pay my respects to the elders past, present and emerging, and extend my respect to the First Nation, Aboriginal and Torres Strait Islanders here today. Aboriginal and Torres Strait Islander people are advised that this presentation may have images, recordings and voices of those that may have passed on. This paper will outline the plant contribution to bush medicine. I will touch on a variety of these and then go into more detail on two bush medicine plants of significance in benefiting the fight against ageing. I will also discuss the Aboriginal use of sugar bag honey from native bees. Bush medicine is drawing on the environment to treat using herbs as a holistic three-step process, along with singing and spiritual treatment to better the health and well-being of Aboriginal people by using their traditional ties to their culture with the land. And that's just the process of how First Nation people are treated now. So they have the traditional medicine and then the Western medicine. Now they work together, because if traditional medicine don't work, they refer them to Western medicine, and if they can't find anything in the Western medicine, then they refer them to the traditional medicine people called the Ngangkari, which are usually elders of the tribe. Traditional methods of Australian bush medicine cures are lost due to the forgetting of language, fractured communities, restricted access to traditional land, and other Western impacts. Knowledge was never written down but passed through stories, singing, smoking and dancing ceremonies. Eating right was one of the main parts of their health and wellness, and a lot of the bush tucker is also bush medicine. There are many native plants used by Aboriginal people in bush medicine. Professor Joanne Jamie, a chemist from Macquarie University in Sydney, has compiled a database of Aboriginal plants. Many of the plants she documented contained antibacterial and anti-inflammatory compounds that are well known to Western medicine. Chemical compounds from the plants used can be classed in 5 different compound categories. Tannins, usually found in the bark but often in the fruits and leaves, are complex chemicals which are astringent, draw the tissues together and contract them, which is useful for treating surfaces such as the inflamed mucous membranes characteristic of coughs and colds. It is also good for bathing wounds. Mucilage, used as a soothing medication for inflamed mucous membranes. Oils from plants with oil glands such as the eucalyptus and the mint family, which are described as aromatic. A number of oils have antimicrobial action. Latex, found in plants that produce white sap, which may be harmless, such as the fig trees, though often can be irritating or even corrosive. Latex contains enzymes that can digest protein, which is very useful when treating warts or in topical cleaning of surfaces of ulcers and wounds. Alkaloids, the most important type of medicinal plant. Usually they have a bitter taste and can be poisonous, and sometimes can be therapeutic like the opium poppy. Methods used for preparation, external or topical. Crushing the flora or fauna with the option of heating and applying to the skin or joint, or with smearing the sap on the skin. Inhalation through boiling and inhaling the vapor, or smoking ceremonies that can create a sterile environment. Internally, drunk as a tea, chewed or eaten. These are some of the books available on bush medicine and Australian medicinal plants. For example, Noongar Bush Medicine, Australian Medicinal Plants and Traditional Healers of Central Australia, Ngangkari. Some of the plants used in bush medicine are eucalyptus. There are many species of the eucalyptus, and it's proven antibacterial and has analgesic properties. It can treat colds and respiratory problems, joint and muscle pain, dental health, fungal infections and wounds. The gum or sap of the tree has high tannin content and can be used to seal cuts and burns. Some eucalyptus, like the lemon-scented gum, can be crushed and rubbed on the skin as an insect repellent. Eucalyptus also has aromatic properties and can be inhaled to benefit breathing and respiratory issues. Tea tree or Melaleuca tetraflola endel can be crushed and inhaled to treat headaches, brewed as a tea for throat ailments, and to relieve colds. It can also be applied to wounds and superficial injuries. The oil is used as a natural antiseptic, has proven antimicrobial properties and antivirals. It is also an effective skincare treatment for blemishes and acne-prone skin. Spinifex grass, Triodes plant, used to soothe inflamed skin, and the resins and waxes from this plant are also used. Emu bush, Emerophila longifolia, and narrow-leaved poverty bush, Emerophila or alternifolia, leaves have been used as a concoction for sores and wounds, as an infusion for colds, headaches, chest pain, and a diarrhea treatment. It is also smoked to create a sterile environment for babies and healing new mothers. Bloodwort, Corymbia opaca, the sap of this tree is smeared on sore eyes, cuts, burns, sores, open wounds, working like a band-aid, sealing the wound. It can also be boiled and drunk and is good for kidneys, chest infections, and cancer. Snake vine, Tinnispora smilacina, is an anti-inflammatory and antiseptic bush medicine plant. The leaves and stems are warmed and mashed into a poultice, which is used topically for arthritis, pain in joints, and other inflammatory injuries. The sap is also used as a broad-spectrum antiseptic. Goat's foot or beech morning glory, Impomea pescapre, is poisonous if not prepared properly. The leaves are crushed and heated, then applied as a poultice directly to the skin for pain relief of stings, bites from insects, stingray stings, snake bites, and stonefish stings. It's also used as a cure for skin irritations, boils, skin infections, ringworm, and hemorrhoids. Witchy grubs. These are classed as fauna. They are both bush tucker and bush medicine. They are a great source of protein, have good fats and vitamin C. It's used externally as a treatment for burns and open wounds, where they crush the witchetty grub into a paste and then put it on the skin and cover it with a bandage to help the skin heal. Native lemongrass, used to treat a variety of illnesses from colds and sore throats to diarrhea, skin rashes, sores, headaches, and migraines. The root of the grass can be made into a tincture that is applied to soothe sore ears. Native pine, Kilotrius gracilis. The leaves and twigs can be boiled and placed on the chest for cold and flu, used as an ointment to treat skin rashes, used for general illnesses, and is traditionally burned and used as smoking medicine. The resinous sticks can also be used as teething sticks for babies. Clay, mud and dirt. The beneficial absorption and binding powers of clay minerals help cure gastrointestinal toxins produced by infection, and also allowing the inclusion of toxic plants into the Aboriginal diet without getting sick. Topically, direct application of specific types of soil were used on fresh wounds. a known source of mud and sediment, can be used to relieve and act as a physical barrier to slow down the growth of infections upon open wounds. The two plants of significance I will go into more detail are the kangaroo apple and the kakadu plum, also known as the billy goat plum. These are both great for the skin, tissues, and the fight against aging. Here's why. Kangaroo apple, Solanum laciniatum, has dark green leaves which are deeply lobed or toothed. The flowers are purple and have 5 petals. The fruit is egg-shaped and changes from green to red and orange as they ripen. The leaves and fruit are poisonous prior to ripening, although the unripened fruit was boiled and drunk as a tea by Aboriginal women for female contraception, supported by Critchley 2018. Kangaroo apple contains amino acids that create and maintain smooth, healthy, younger-looking skin. They also encourage exfoliation of dead skin cells. A kangaroo apple extract contains anti-inflammatory properties to soothe irritated, stressed skin. Its wound-healing properties can speed up the healing of scars. Kakadu plum or billy goat plum, excuse me, Terminalia ferdinandia, has deciduous pale green leaves with small creamy white perfumed flowers. The fruit is yellow and green, with the ripe fruit being very pale and even pinkish. Kakadu plum is the world's richest botanical source of vitamin C. They're a great source of vitamins, antioxidants, and many nutrients, like fiber, copper, zinc, magnesium, folate, calcium, and vitamin E. It is also rich in plant compounds like agallic acid, and flavonoids. Vitamin C is important for the collagen production, which improves fine lines, wrinkles, and helps our skin slow down the aging process. It benefits by improving elasticity, which further helps reduce the signs of aging. Kakadu plum brightens the skin, cures pimples, protects the skin from damage caused by the sun's UV rays, increases skin hydration, and fights the early signs of aging. If you have hyperpigmentation, blemishes, or dark spots, then using a serum of kakadu plum will have benefits. Aboriginal people and native bees. Aboriginal people in the northern and eastern states of Australia have been utilising the benefits of native bees for centuries. Australia has around 12 species of native bees that do not sting. And on this map is where they are mainly found, in the coloured areas. The main species are the Trigona species, and the Australoplebia species are 2 of these. These bees produce sugar bag honey, a highly prized bush tucker and medicine of the Aborigines, who gathered it from wild nests that produce less than 1 kilo of honey per year. Native bee honey has a distinct flavour, which is sweet and tangy with eucalyptus and lemon notes. It's high in antibacterial and antimicrobial properties. The honey has a cloudy appearance, meaning that there's a high propolis content, producing antibacterial, anti-inflammatory properties and antimicrobial properties. Native Australian honey contains a rare and naturally occurring sugar profile that is different from other honeys. It's called trihallulose, and it has a lower glycemic index, or GI, than regular honey. All consumers get this benefit, but diabetics are mainly impacted without getting that rapid increase of blood sugar caused by glucose and fructose. Trihallulose is absorbed more slowly into the bloodstream. University of Queensland organic chemist Associate Professor Mary Fletcher has identified specific bioactive components of stingless bee honey, providing evidence that supports the health and benefits of native bee honey. Native bee honey is stored and infused with propolis or bee glue, shown by numerous researchers to have valuable healing and biomedical properties, including antibacterial properties, comparable with medicinal grade Manuka honey. Aboriginals used to follow the bees by sometimes gluing feathers onto the bees and following them back to the nest. They would then harvest the full nest. The sugar bag honey was eaten, wax, honey, pupae, dead bees, ants, and all. They sometimes squeezed the honey from the comb into containers, saving it for later. The wax was extracted and then beaten and mixed with powdered charcoal or ochre and rolled into balls or lengths and used for sealing waterproofing containers used on tools and for the mouthpieces of didgeridoos. Honey was used to clean the gut by eating large amounts of honey or large amounts of pollen mixed with water. In eating the honey, they also had the benefits of the propolis. A quick recipe, which is a soothing face mask for us to use and feel the amazing benefits of native Australian flora for our skin. We're going to have 1/3 cup of instant oatmeal, 1/2 cup of hot water, a tablespoon of Manuka honey, 1 to 2 tablespoons of plain yogurt, a tablespoon of Australian pink clay, and a teaspoon of Kakadu plum powder. Mix it together and apply it to your face, and after 5 to 10 minutes, wash your face clean. Then apply your usual moisturisers. In conclusion, a word of caution, as many Australian plants are highly toxic and difficult for an inexperienced person to identify. Ngangkari referred to the traditional healers, Aboriginal elders of high degree, that are present in Western health clinics to perform rituals and give medical advice. There's a link to one of the Ngangkaris that I could find. Like all medicines, bush medicine should be taken with care and advised by traditional owners, healers, or naturopath professionals. In addition, most plants require permission from traditional landowners before you can harvest any flora and/or may be prohibited by law in some locations. Thank you very much for paying attention and for your company. And my references quickly.